At this point in the program, you've begun to grasp the importance of eating to optimize gut health. This is the missing link between nutrition and mental health. It's time to take it one step further. Controversy on how to best treat gut-related issues still exists. For example, some practitioners focus on eliminating foods to starve off opportunistic bacteria, and others aim to improve gut health by feeding the beneficial microbes. Both approaches have merit and are usually necessary in combination. If you have persistent gut-related issues, consulting with me may be worthwhile after one more week of effort. There's lots of good supplements on the marketplace that can help you. One area where research does agree is concerning bacterial diversity. Approximately 1,000 diverse species are residing in the human gut. Having a wider range of bacterial species is associated with health benefits, including weight regulation and depressive symptoms. Alcohol and drug use negatively affect gut bacteria with reductions in beneficial species and overgrowth of others, which is known as dysbiosis. Some of these changes stem from increased gut lining permeability, sometimes referred to as leaky gut. Additionally, many commonly used psychotropic medications negatively affect bacterial diversity, which may explain some of their side effects, including weight gain. If you're on medications or have any history of alcohol or drug use, then you need to pay even more attention to your gut health. Are you here for it? So, where to start? By now, you're hopefully eating from all food groups multiple times a day. This is the first step in improving bacterial diversity. You might be taking a probiotic supplement, which is generally a great idea. For a probiotic recommendation specific to your needs, consult with me. If you're drinking chia water every day, you're doing one of the best things you can do for your gut. Chia seeds are an excellent source of soluble fiber, which colonic bacteria feed on. The next step is to eat beans on most days of the week. This includes chickpeas, black beans, lentils, or any other bean you enjoy. If beans are rough, start with hummus. Canned or boxed can work fine, especially if you rinse them of any added salt. If you're not getting your beans, nuts, and seeds several times per day, now is a time to ramp up those efforts. Within the next week, we'll be focusing on ways to include more of these gut healing foods. Other known gut health strategies to include daily fermented vegetables such as sauerkraut or kimchi. Use as a small part of your plate or your bowl. Fermented dairy products such as yogurt or kefir. If there's any dairy products to eat, these are the ones. And there's also plenty of non-dairy versions of these now. Remember, full fat and unsweetened is the best route. Bone broth, which contains collagen protein and gelatin and includes the amino acid glutamine, all of which are beneficial to the gut barrier. Plant-based eaters can find glutamine supplements not from animal sources. So what are the foods exceptionally high in these prebiotic fibers? You ready? Fruit includes raspberries, bananas, apples, pears, and kiwi. Don't forget to eat the kiwi skin. Vegetables include Brussels sprouts, cabbage, artichoke, asparagus, onion, leeks, and jicama. Ooh, a little lime on the jicama as a snack. Grain include barley, oats, quinoa, and millet. Beans include peas, chickpeas, lentils, black beans, white beans, pinto. Nuts include all nuts. But make sure to eat the skin, especially on the almonds, cashews, Brazil nuts, and pistachio. Seeds include chia, pumpkin, sunflower, and flax. The next step is to increase bacterial diversity by increasing the variety in your diet. In other words, by consuming a wide range of plant fibers, there may be a wider range of species that reside in your gut. This may seem difficult to those with a limited selection of foods, but trust that your gut will thank you. If not immediately, then eventually. Lean into this. Remember to challenge the idea that calories are the best barometer for food choices. If you're avoiding foods based on calories alone, you may be working against efforts to improve your bacterial diversity. Your next assignment is to select several foods from each category of plant foods to bring into rotation. We'll cover each of these categories over the next week, so you'll have a chance to modify your selections as we go along. For fruits, select 6 of them. For vegetables, select 8. For whole grains, select 4. For beans, select 2. For nuts, select 2. And for seeds, select 2. Operation Heal the Gut is in full force. Shh!